Have you ever wondered how nurses make those critical, split-second decisions that lead to the best possible patient care? Well, it's not magic, and it's not a gut feeling. It's actually a powerful framework for critical thinking. Today, we're going to break down the 5 essential steps of the nursing process. Think of it as the fundamental operating system that guides every single professional nurse. So what really is the secret to great nursing care? You know, it's not just about completing tasks or following a doctor's orders. It's a systematic, really deliberate process that puts the patient right at the center of every single decision. It's a whole new way of thinking.
All right, here's our game plan for this explainer. We're going to start with the blueprint of nursing itself. Then we'll walk step by step through the 5-part framework using a real-world kind of example. We'll see how that thinking process turns into a concrete care plan, look at some common mistakes to avoid, and then wrap it all up with why this process is so absolutely crucial for modern healthcare.
Okay, first up, nursing's essential blueprint. Before we jump into the how, we really need to understand the what. What exactly is this process, and where did it even come from?
So, the official definition of the nursing process is a systematic, rational method for planning and providing individualized, patient-focused care. Now, the key words there are systematic and rational. This isn't about guesswork, right? It's a scientific approach that really forms the very heart of professional nursing. And, you know, this process has grown over time. It all started back in 1958 with a nurse theorist named Ida Jean Orlando. By 1967, it was shaped into 4 steps. But the real game changer? That came in 1973, when the American Nurses Association pulled out diagnosis as its own distinct and critical step, giving us the 5-step model that's used all over the world today.
Okay, let's get to the heart of it, the 5-step framework. Now, to make this really click, we're going to follow the journey of a hypothetical patient. That way you can see exactly how these steps play out in a real situation. And here they are: assessment, diagnosis, planning, implementation, and evaluation. You'll often hear nurses use the acronym ADOPIE. That's ADPIE. It's the perfect way to remember this blueprint for solving patient problems in a really methodical and effective way.
It all kicks off with assessment, the A in ADPIE. This is all about collecting information, and it comes in 2 flavors. First, you've got subjective data. That's what the patient tells you, like feeling afraid or not wanting to eat. Then you have objective data. That's what the nurse can actually see and measure, like the patient not being able to get out of bed or maybe getting angry with the staff.
Next up is diagnosis, the D. And this is so important to get right. This is not a medical diagnosis. A doctor diagnoses the disease. A nurse diagnoses the patient's response to that disease. So in our case, the judgment isn't just pain. It's anxiety related to uncontrolled pain. See how that gives a much fuller, more holistic picture of what the patient is actually going through? Once we have a clear diagnosis, we can move on to planning, our P. This is where the nurse sets goals that are both measurable and achievable. For our patient, the goals are super specific. Move from the bed to a chair 3 times a day and get that pain level down to a 4 out of 10, all within the next 24 hours. Step 4 is implementation, the I in ADPI. This is the action phase, where the plan gets put into motion. The nurse doesn't just give pain medication. They also provide counseling for the anxiety and suggest smaller, more frequent meals to tackle the poor nutrition. It's a whole package of interventions based on that specific nursing diagnosis. And finally, we have evaluation, the E. Now, this isn't just a final checkbox. The nurse is constantly evaluating the patient. Did the plan work? Is the pain getting better? As this quote says, the process is really a cycle. Based on new information, that plan can be tweaked and adapted at any time. So we've got this mental framework, this way of thinking. Now let's talk about how that gets turned into a physical document, the care plan. This is how that blueprint gets written down, shared, and followed by the entire healthcare team. And the key to a really great care plan is setting SMART goals. This acronym is such a powerful tool because it forces clarity. Goals have to be specific, measurable, achievable, realistic, and time-bound. This whole framework just gets rid of any confusion. So instead of a vague goal like the patient will feel better, you get a laser-focused target like the patient will report pain below 4 out of 10 by 5 p.m. It ensures everyone is on the exact same page. Of course, even with the best systems, there are potential pitfalls. So in this section, let's go over some of the common mistakes that can happen and, more importantly, how sticking to the process helps us steer clear of them. Honestly,
The single biggest mistake is incomplete data collection. If a nurse only focuses on the physical problem, the pain, and completely misses key psychological or social factors, the diagnosis is going to be wrong. A really comprehensive assessment is the foundation of everything. It's about looking at the whole person, mind, body, and spirit. Another big pitfall is making a generic diagnosis. Every single patient is unique. Using a one-size-fits-all approach just doesn't work, and it can even be harmful. The nursing process forces you to take a personalized approach, to tailor that plan to the individual's specific needs and life circumstances. But what happens when a patient has a bunch of problems at once? Well, that's where prioritization comes in. Nurses often use frameworks like Maslow's hierarchy of needs. Just think of it as a pyramid. The most basic survival needs, like breathing and safety, are at the bottom. You have to take care of those foundational needs first before you can even think about addressing higher-level ones like self-esteem. It's exactly why a nurse will always stabilize a patient's breathing before they start dealing with their anxiety.
So this brings us to our final section. Why does any of this matter? Let's zoom out for a second and look at the bigger picture and the really profound impact this way of thinking has on healthcare as a whole.
At the end of the day, this process isn't just some academic exercise. It delivers real, tangible benefits. By making sure documentation is clear and the teams can collaborate, it leads directly to better patient outcomes. And by giving nurses a reliable structure for making decisions, it empowers them with the confidence to turn all that textbook knowledge into effective, compassionate care right there at the bedside.
And this quote highlights what is maybe its most important role today. The nursing process is the vehicle that drives evidence-based practice. It provides that essential structure that allows nurses to take the absolute latest scientific research and apply it directly to patient care. It ensures that every patient receives the most current and effective treatments we have. Which leaves us with one final thought to chew on. This process has been the backbone of nursing for over 60 years, and it's evolved and adapted the whole way. But as healthcare gets even more complex, with new technologies and new challenges, how will this fundamental way of thinking need to evolve to meet the demands of the future?